This latest news about Tylenol and autism isn't news at all to those of us who subscribe to the Herbal Database, because we've covered this at depth, not only the risk of autism, but other risk factors involved in Tylenol and how to use it safely. So we're going to start off in the database by looking at this list of fluorinated drugs. Fluoride accumulates in the body. So people who drink unfiltered tap water regularly are more susceptible to poisoning from fluorinated drugs, which include, but are not limited to, Tylenol, Advil, Prevacid, general anesthesias, chemotherapy, painkillers, antidepressants, and anti-anxiety drugs. Once the body reaches the saturation threshold, symptoms become unbearable and unmanageable by doctors, including severe nervous system disorders, nerve pain, tendon ruptures, gastrointestinal issues, sensory impairments, autoimmune diseases, blood sugar problems, even emotional disorders. And due to the catapulting of drug toxicity by fluorination, the human threshold for toleration can be crossed after just a few prescription pills. Imagine how many people wash down such medications with unfiltered tap water that contains fluoride, or drinks made with fluoridated water. Once a person becomes poisoned by the bioaccumulation of fluoride, they can become hypersensitive to even extremely small amounts. The fluoride in drugs is boosted far beyond the limits allowed in drinking water, and is also commonly mass prescribed in anti-inflammatory steroids and anesthetic drugs used to put patients under for surgical procedures. In 2013, research revealed that all human organs experience cellular deterioration from toxic fluorination, including connecting tissues and the nervous system. This is why medical doctors can be so confused by the myriad of symptoms most of their medicated patients keep returning to them with. If you want to know what drugs are fluorinated, I'm going to scroll up to the top, and here is an index of fluorinated pharmaceuticals. Notice the color coding. In the herbal database, the color of gray here indicates that something is toxic. Now let's go to acetaminophen, known as Tylenol. Note that children metabolize Tylenol differently from adults. There's more on that as we get into this. And also, see here, click on that to learn about how it damages the liver. So it was first discovered in 1877, and yes, it does have fewer side effects in therapeutic doses compared to aspirin. Hepatic necrosis, or liver failure, was first reported in 1966. Now here's a graphic that shows us some of our herbal alternatives to Tylenol. We're going to skip these videos. Now this video is Tylenol dangerous during pregnancy. That came out 3 years ago. In 2023, there was a class action lawsuit against the maker of Tylenol, alleging that use during pregnancy led to birth disorders and autism. But a federal judge blocked the evidence from being presented, effectively ending the case. That was 2023. Now here's the rub. Tylenol is found, or acetaminophen, is found in a lot of different medications. So you're going to need to look on the label and see if you find acetaminophen. It's also called paracetamol, because it is usually paired with a lot of over-the-counter medications. This is how some people can wind up with an overdose. It's not going to be called Tylenol. For example, it's in Dayquil, NyQuil, Excedrin, Vicodin, Norco. Symptoms of overdose. Early on, there's going to be nausea and vomiting, no appetite, pallor, and confusion. It's a very potent liver toxin. So several days later, it leads to jaundice with severe liver failure. It's the leading cause of liver failure, by the way, progressing to liver transplant or death. People think they're taking a safe dose, but then they take another medication, like cough syrup that contains it, or a combination antihistamine decongestant that contains it, or some other prescription drug that contains the fluoride. And we've already seen what happens then. A toxic dose is considered 200 milligrams per kilogram of body weight. And here we see what the toxic dose is for a young child. A single ingestion of more than 150 to 200 milligrams per kilogram of body weight. For example, if a child weighs about 22 pounds, a potentially toxic dose would be 1,500 to 2,000 milligrams or more. And that's based on something called the 150 rule. It's used in clinical toxicology that guides doctors on when to initiate treatment with N-acetylcysteine, or NAC. That is the antidote for acetaminophen poisoning. And here is some more guidance for safe pediatric dosings, typically 10 to 15 milligrams per kilogram of body weight every 4 to 6 hours, not exceeding 75 milligrams a day. Toxicity risk increases with repeated high doses or, of course, accidental ingestion of adult formulations. And it definitely increases when there are underlying liver disorders or using with alcohol, or as we've seen with other medications that contain it. Now, I'm not going to go through all of this, but for those of you who geek out on biology, you might want to come in and read up on how it is metabolized. Basically, what happens is most of it is metabolized in the liver, as long as it's a reasonable dose. And there's some processes there that result in a non-toxic product when it's metabolized in the liver. About 2% of that is excreted in the urine. However, 5 to 9% of it gets metabolized into something very toxic, N-acetylp-benzoquinonamine. And that is a major pro-oxidant. It causes significant oxidative stress. And if it's not dealt with, it can lead to cell death. So the body has a way of metabolizing this to a non-toxic substance. And what it's doing is it's using something in the body, one of our major antioxidants, called glutathione. But there's a problem. It can use up too much glutathione, especially if our body is not making enough of it to begin with. And if we don't have enough glutathione in the body to convert that to a non-toxic substance, then of course we have a problem. And the other problem is that if the glutathione's used up quickly, especially with a high dose of Tylenol, then it is not able to detoxify that N-acetylp-benzoquinonamine, and we lose completely our store of glutathione. In the hospital, NAC is given to replenish glutathione. So if you look over on the left, we've got a bunch of things here that are used to offset the negative effects of Tylenol. And one of them is a supplement that many of us have and keep on hand, N-acetylcysteine. So if you're having a situation where your stores of antioxidants or the increase in pro-oxidant situation causes the storehouse of glutathione to be reduced. So you're having too much oxidative stress, or even chronic use at low levels. Your glutathione could be decreased because of the way this system of metabolism works. And that can have a negative effect on many systems, including development of the fetus. And here's a section, I'm not going to go through it, I invite you to come in and see it for yourself, but here are the key differences in children versus adults. And now we're going to get into autism risk. We've been talking about glutathione and oxidative stress. And there are a lot of things that can cause oxidative stress. Pregnancy by itself does that. So you don't need any more of it. And if you click on this, you'll learn all about oxidative stress and how to counteract it. So it's possible for someone to go around perfectly fine, limping along with some oxidative stress and the occasional use of acetaminophen could cause a reduction in glutathione and cause processes that require antioxidants in the cell to not have them. And that's important when we're talking about autism. It's related. And there have been studies that have shown that it's related to oxidative stress and also mitochondrial dysfunction, which requires antioxidant therapy. If you don't know about the mitochondria, there's just a ton of information about that here in the database. So there was a study, and this is what they've been pointing to recently, this study that came out in 2025, and this is the paper, Evaluation of the Evidence on Acetaminophen Use and Neurodevelopmental Disorders Using the Navigation Guide Methodology. And here's just a little summary. Acetaminophen is the most commonly used over-the-counter pain and fever medication taken during pregnancy, with over 50% of pregnant women using acetaminophen worldwide. Numerous well-designed studies have indicated that pregnant mothers exposed to acetaminophen have children diagnosed with neurodevelopmental disorders, including autism spectrum disorder and attention deficit hyperactivity disorder, at higher rates than children of pregnant mothers who were not exposed to acetaminophen. And here's a little bit about what the navigation guide is all about. It's a systematic, transparent methodology used to evaluate the quality and strength of evidence in environmental health research, particularly for assessing the impact of environmental exposures on health outcomes. It's quite a valid tool, and there's more about that here. But one of the things they found was that acetaminophen crosses the placenta and may disrupt fetal brain development through mechanisms such as oxidative stress. While observational limitations prevent definitive causation claims, confounding factors like maternal illness were addressed. The study showed a link. They're not saying it's causal, and they do believe that the biological connection could be through oxidative stress. So the scientific consensus as of September 2025 is there's no proven causal link between acetaminophen during pregnancy and autism. However, multiple large-scale observational studies and meta-analyses have identified an association with prenatal exposure linked to a modestly increased risk, typically around 19 to 21% higher odds. This association is stronger in higher quality studies and for longer and more frequent exposure, but it may be influenced by confounding factors like maternal illness, genetic predispositions, familial patterns, where parents with neurodevelopmental traits are more likely to use the drug or have affected children. So moving on, here are the proposed biological mechanisms. Could be endocrine disruption. Acetaminophen can interfere with hormone signaling, particularly the prostaglandins and endocannabinoids, crucial for neuronal migration, synapse formation, and brain wiring during critical prenatal windows, the second and third trimesters. Animal studies showed it can alter sex-specific brain development, potentially explaining slightly stronger associations in boys. Oxidative stress and inflammation. Its metabolites can generate reactive oxygen species, leading to inflammation or cell damage in the developing brain, and this might disrupt neuroplasticity or increase vulnerability to autism spectrum-related traits like social communication deficits. And then there's the gut-brain axis effects. Emerging evidence suggests it could alter maternal gut microbiota, indirectly affecting fetal neurodevelopment through the microbiome. Here's a chart that gives an overview of the key evidence. But let's just keep going. You know, whenever I find something's a problem, I always start looking for a solution. And here's a little bit on some things that could help. That's what we're getting into now, guys. Melatonin and sunlight. So it turns out that melatonin is the most powerful antioxidant, even more powerful than glutathione. And it's being made in our mitochondria and can affect major changes in terms of oxidative stress. It's also interesting that sunlight, specifically infrared light, has been shown to increase that type of antioxidant effect. And here's a paper here you can click on to read called Melatonin and the Optics of the Human Body. So it's been shown that mitochondria produce melatonin in many cells in quantities which are orders of magnitude higher than that produced in the pineal gland. 5% in the pineal, 95% in the mitochondria. So what we're saying here is there's evidence that links autism, which is a mitochondrial dysfunction disorder, among other things, with acetaminophen use. And we've showed through well-known metabolism of acetaminophen that it can exacerbate oxidative stress, especially if there's a reduction in available antioxidants. So this paper in this article showed that optics of the human body, including a woman who's pregnant, that as the uterus grows and the wall of the uterus thins, this opens up a window of transmission specifically of infrared light, which has been shown specifically to increase melatonin production in the mitochondria. Near infrared light, specifically from the sun, can penetrate through the skin and out the other side and affect changes at the mitochondrial level that reduce oxidative stress, increase ATP, increase carbon dioxide production because metabolism's improved, and reduce glucose in the systemic circulation because of that increased use of fuels. Here's another study. Longer wavelengths in sunlight pass through the human body and have a systemic impact, which improves vision. We've seen clearly that the very type of light that induces this has been decreasing in a systemic way for 200 years, and this is because we're indoors more, we're using the fluorescent lights, the LED bulbs, low E glass, less time out in the sun, we get less and less of this infrared light. Could it be putting our bodies into a state of reduced antioxidants and increased oxidative stress? So when we're exposed to medicines like acetaminophen, which can exacerbate mildly that balance, that could be causing and increasing the risk of autism. Now there's also another topic we need to look at, and that is things that interact with acetaminophen. Vitamin C. According to one study, at very high doses, 3 grams daily, vitamin C might increase serum levels of acetaminophen, and that could allow the drug to accumulate to levels that may damage the liver. Echinacea, when combined with acetaminophen, can result in increased incidences of hepato or liver toxicity and nephro or kidney toxicity. Kava, when combined with acetaminophen, can result in increased incidences of liver toxicity and kidney toxicity. Here's a study on that. Also, ginkgo can interact with it to increase the risk of bleeding. And there's the source for all that there. Then there's a whole bunch of articles and studies that I've been archiving for many, many years. One of the interesting studies that came out that Tylenol kills empathy. It reduces people's empathy for the pain of others. Acetaminophen is an ingredient in over 600 different medications. This ubiquitous painkiller doesn't just kill pain, it kills our fellow feelings. Here's a study that concluded that acetaminophen use during the second and third trimesters of pregnancy is a direct cause of increased risk of multiple behavioral difficulties. And then we see here that Tylenol doesn't even work. Despite being the most recommended drug for back pain, double-blind research shows it's no better than a placebo. And we know it doesn't work for we now know it doesn't work for the pain of osteoarthritis either. Protracted use of acetaminophen for 1 week may suppress fetal testosterone production, which could have adverse consequences. A variety of observations suggest that its use has contributed to recent increases in asthma prevalence in children, and a biologically plausible mechanism of glutathione depletion in airway mucosa. Until future studies document the safety of this drug, children with asthma or at risk for asthma should avoid it. And then here are a bunch of studies on risk factors. Let me pick a few of them out. Painkiller, soul killer. That's the one where we find decreased empathy. Here was the case, a lawsuit where J&J uses legal challenges to delay lawsuits about it causing autism. Tylenol just once a month raises a child's asthma risk 540%. This one's a consumer alert, the deadly reason why it should be banned. Here's another side effect. Antipyretics, that means something to lower fever, like Tylenol, increase influenza-associated mortality. More studies about empathy. Chronic Tylenol use is associated with an almost 2-fold increased risk of blood cancer. It's been linked to unexplained dyspepsia. It can damage human mesenchymal stem cells. There are several studies about autism and other neurological disorders. So what are the protective agents? And fortunately, we've got a bunch of them. And you'll see them on the left. The purple color means it's a phytochemical that's going to be in a food or herb. Amygdalin protects against acute liver failure. Inoquiol, which comes from magnolia, also attenuates acute liver injury. Moringa shields kidneys from acetaminophen toxicity. Cinnamon oil could be an alternative nutraceutical substitute. Dandelion extracts. Pre-treatment protects against liver injury. Here we see more on N-acetylcholine. So as you see here, we've got a bunch of them. Ginger, canossic acid, berberine, curcumin, and of course you can click on these and read more about what they're doing. But these are studies about all of these natural agents that we have available to us. If you look on the left, I'm just going to move the scroll bars so you can see more of them. If you look underneath Tylenol, these are all substances or therapies that help protect you. So folks, that is a deep dive into Tylenol. Use it carefully if you're going to use it. And I would recommend using something else because we have wonderful pain relievers in our plant medicine. I will see you next time. Let me know if there's a topic you want me to cover. Oh, by the way, the herbal database is available for $15 a month or $100 a year.